Okay, let's talk about how to differentiate between the different kinds of lochia. The first stage of lochia is called lochia rubra. This will happen from day 1 to day 3. So these are bright red discharge, and the clot should be not very large, fleshy odor, moderate to scant amount. This says nickel, it can be up to a quarter without it being large. And then you'll see an increase in flow upon movement or breastfeeding because it causes the uterus to contract. The next stage is lochia serosa. This is from day 4 to 10. You'll see almost a serosanguinous discharge, and it should have no strange odor again, and you'll see increased flow during physical activity. The last kind of lochia is lochia alba. This is from day 11 to up to day 21, and this is yellow to white. This is the last part of the endothelial tissues being shed. You should see a small amount. And what's an important part to teach your patient is that if they go from lochia alba back to lochia rubra, then she knows that there could be a problem. And postpartum hemorrhage can happen after they've gone home from the hospital. It's not just something that happens in the hospital. And it will persist longer when women are breastfeeding because of the constriction of the uterus. So let's talk about incision teaching. So anytime there's an episiotomy, cesarean section, lacerations, anything like that, we're going to teach women to look at RITA. And really as nurses, when we're assessing, we're going to look at RITA also. And this is just a way for you to look at the incision and to evaluate if it's getting worse. So we're going to look for redness, edema, bruising, discharge drainage, and approximation. So I see a lot of questions where they're going to ask you what they're looking for in incision, and a lot of times the answer is approximation. You want to look look to see if the edges are approximated, because if you see that the incision is going to dehiss, the edges of the incision will start to come apart. So we don't want to see an increased amount of redness. So a lot of students ask me, well, isn't the tissues going to be red, edematous, and some bruising just from the trauma of delivery or from birth? And yes, but we're actually looking at the incision. So we're looking to see if the incision is red, is edematous, has bruising, if there's discharge or draining, and approximation. And we're going to look for increasing redness, increasing edema, increasing bruising. If they're decreasing or getting better and we see no discharge and the edges are nicely approximated, then we know that this incision is doing well and we have no need to fear that there's an infection in that incision. The P in the bubble pen is for pain, and we're going to assess this all the time. When we give pain meds, you need to assess it after 30 minutes to make sure that the pain med that you gave was effective. And that's an important part of charting, is to go back and assess their pain every 30 minutes after you give any kind of pain med. So the pain can come from lots of different places. Usually it's going to come from their abdomen, and it's going to be more of an achy pain. But we're going to assess pain a lot, and we're going to assess pain from 1 to 10 scale, and we're going to ask them what level of pain they are. And we're hoping that it'll decrease after we give them their pain medication. So we're also going to look at their emotional status. A lot of women will experience some sort of emotional sadness. These are called the baby blues, and most women experience this. A lot of it's because of loss of sleep and just the hormonal fluctuations after giving birth. But we're going to look for things that are maybe more than just ordinary baby blues. We're going to look for postpartum depression, and postpartum depression happens after postpartum blues, and it continues without any kind of intervention, and it's a more serious sort of condition. So we're going to ask questions like, is the patient independent or is she completely dependent? Is she elated or despondent? What does she say about her family support? And then we're going to look for her non-verbal cues, like, is she holding her baby? Is she happy about her baby? When you talk to her, does she seem happy overall? And is she able to care for herself and her infant without assistance? There are certain phases that a mom will go through to attain the maternal role, and these are expected, and we're going to watch for these things when we care for our patients. So phase 1 happens in that first 24 to 48 hour period, so the first 1 to 2 days after giving birth. And really, she's going to be excited and talkative, and she's going to want to review her birth experience and tell friends, family, nurses, doctors about what happened and how she's responding to that. So as a nurse, we're going to listen to her, and we're going to listen to her birth experience in the way she tells it, and really give time to sit there and listen to her telling the story. And friends and family will do the same for her. In phase 2, this begins about day 2 or 3, and it lasts a while. And this is when she focuses on taking care of the baby, learning how to diaper the baby, bathe the baby. She wants to take charge. She wants to have acceptance from others that she is capable of taking care of her infant. At this time, she'll probably be experiencing some kind of baby blues, and that is a normal experience. In phase 3, the last phase, this is when, instead of focusing on her and the baby, she's going to focus on the family as a unit, bringing that baby home as a family. And she's going to resume her other roles, either as an intimate partner or as an individual. And this is normal for the maternal role attainment. When we think about nutrition in the postpartum, we're going to encourage mom to eat a diet high in protein to aid in that tissue repair. Make sure she's drinking 2 to 3 liters a day, and included that with calcium-enriched food. And we want, as if she's breastfeeding, we want to still have her increase her calories by 330 calories a day for that first 6 months, so that she can maintain a sufficient supply of breast milk. And then with a newborn, we're going to teach things like time at breast and how much intake she'll have in milliliters or ounces. It's easier for patients to understand ounces than milliliters. So we want the baby to take about 15 minutes on each side every time they breastfeed. And we want to teach women to feed the baby on demand, because if we're going to put them on a schedule, it's not going to think about when their baby is having growth spurts. So they'll eat more often when they're growing more rapidly. And they should lose 10% of their body weight in the first couple of days, and then they should gain it back by about 10 days to 2 weeks. They should gain back their birth weight, and then they should be gaining weight after that. So when we look at the cervix, this is a cervix that from a woman who has never had a baby. Once a woman has a baby, her cervix will be this, when it's a closed cervix and she's not pregnant, it will look like this line. So after delivery, the cervix is soft, edematous, and dilated and have little tone. You may see a little bit of lacerations, and then we want that cervix to be completely healed about the 4th to the 6th week after delivery. We're going to teach perineal care. So it's kind of the same thing we did for lacerations. 24 hours, we're going to have ice on it to reduce swelling. We're going to give those witch hazel compresses that I talked about to help with discomfort and healing. And we're going to talk about wiping front to back and to change her peripod very often. And to use a peri bottle when she is using the restroom or urinating. So we'll fill that peri bottle with warm water, and we're going to position it between her legs, squirt warm water front to back, and then we're going to blot with either antiseptic wipes or toilet paper, front to back. We're going to teach Kegel exercises, which just help promote the strength of the pelvic muscles. They're going to tighten and then relax their pelvic floor muscles, and they can do it at any time. And women should do this throughout their lives to keep that perineal floor really strong. When we do discharge teaching, we're going to teach for potential complications, things like chills or fever greater than 100.4, change in that vaginal discharge from larger clots or more excessive bleeding. We're going to teach her that RITA to look for signs and symptoms of problems with any sort of incisions. Any kind of pain or tenderness in the abdomen or pelvic areas, she'll want to go in and talk to her provider about. Anytime there's breast tenderness or cracks, redness, blisters, she'll want to call her provider. And then if anytime there's localized pain in her calves, so we're going to teach her about risk factors with DVTs, and then we're going to teach her about UTI symptoms and what that looks like too. So she'll want to call her provider when she has any kind of signs and symptoms of a UTI. So also we're going to teach about postpartum depression. For each one of our postpartum clients or patients, we will give them a questionnaire about whether or not how they're feeling, and we're going to score it and chart it, and we're going to put that in for risk factors for postpartum depression. And we're going to teach her to talk to her healthcare provider after her postpartum visit if she's having any sort of problems with apathy, she can't provide care for her infant, or feeling that she may hurt herself or the infant. And then before they leave the hospital, we want to make sure that she has a follow-up appointment. We want to make sure she has it set with her provider before she goes home, and we put the date and time written on her postpartum teaching papers. For a vaginal delivery, she can go about 4 to 6 weeks, but for a C-section, we want her to go in sooner because there's more risks of complications. And this is the end of the postpartum normal teaching. So I'm going to go over postpartum complications next, and then also the postpartum hemorrhage protocol after that.